Hey everyone, I'll get started in just a couple of minutes here. If anybody is having any trouble, just let me know. We're just testing this out right away. All right, hang with me a minute here, guys. I'm just trying to figure out how to get this to go full screen. All right, perfect. So I have enabled the Q&A. Let me know if you have any questions at all while we're going through this. And don't hesitate to stop me and ask any questions you have. So I am Dr. Erica Boland, and I am with BIRTHFIT Wisconsin. And I'm going to talk to you about the pelvic floor and core health. So when I started my work with chiropractic. I never really imagined I'd get this much into pelvic floor and core health, but over my time working with a therapy out of Prague called DNS, and then as well working with women postpartum and as a doula and a chiropractor, I started to see that there was this gap in our system. So we'll talk about that throughout, but really the goal here today is to give you a little bit of direction on where to go, whether you are planning to become pregnant or whether you're currently pregnant or just gave birth or are even up to years postpartum. Dealing with pelvic floor and core issues, which really go hand in hand, isn't something that you need to deal with forever. And a lot of times I think that because it is underaddressed, that women feel it's just something that is always going to be there. So we'll get into that, but we're going to start the PowerPoint here. Like I said, let me know if you have any questions at all. I'm going to pull up our Q&A here so I know when people are popping in and asking any questions. All right, so why do we care so much about your pelvic floor and your core? So your pelvic floor is really actually part of your core muscles, and your core is your powerhouse. So your movements are generated here, and your movements are from here are based on, all of your movements are based on having stability here. So everybody should care about this because it's really the basis of your movement and starts as a newborn. So we watch babies develop and nobody teaches them how to roll over, how to sit, how to stand, how to walk, but yet they learn it. They do it physiologically on their own. And over time, due to, poor posture or many different reasons, childbirth being one of them, we can develop some poor patterns in our movement. And then it becomes kind of a chronic issue. So if it's not addressed, then your body is pretty smart. It'll get you from point A to point B, but maybe through compensation instead of actually having stability in that area. So when is a good time to start working with your core and pelvic floor? Ideally, you would be strong in this area from the get-go, but that isn't reality. For us at BIRTHFIT, it'd be really awesome if we could work with every mom pre-conception so that she has a stable core before she even conceives. Like the PowerPoint says, reality is we aren't there yet. So a lot of times right now, as far as in my practice, I'm catching people on the postpartum side of things. And usually it is unfortunately because that they have decided that they want to address whatever issue it is that they're currently experiencing. After baby is born, mom goes in for a 6-week postpartum appointment and mom is cleared. So at that visit, most of the time, what you're being checked for is making sure there's no infection, making sure that you've healed properly. A lot of times moms are given a questionnaire to rule out postpartum depression or maybe test for postpartum depression, in which case that's dealt with in many different ways depending on the provider. So really at this 6-week postpartum appointment, they're looking for major issues. So when mom is quote unquote cleared, a lot of times there's not really much direction on where does mom go from here? What does that mean? If you're cleared for physical activity and sexual intercourse, what does the physical activity portion of that mean? And what should you be doing? I hear often that moms are told, you can start doing some crunches or some sit-ups to help strengthen your core, which is actually quite opposite of what you should be doing. And we'll get into that a little bit as well, but it's just a disconnect in our system. So whether you're seeing an OB, gynecologist, a nurse midwife, it isn't their fault that they aren't instructing you on what to do. So it's not something that I really want the blame to be on them, or that we should put the blame on them, but this isn't their ball game. This isn't what they went to school for, and this isn't what they specialize in. The place that I see the issue is in the lack of referral. And that's just something that over time hopefully will change as more and more people become aware, whether it's the patients that are realize that, I should be doing this afterwards, or this is a concern to me, so I need to go see someone. And then on the practitioner's side, if they see an issue or even start to just refer that referral source to check for diastasis, pelvic floor dysfunction, things like that. So when I say referral, what I mean by that is you want to be referred to maybe chiropractor, maybe PT, someone that's functional and is going to assess the movement and the core and the issue as a whole. It's really important that you see someone that really knows what they're doing with this in order to get really good help. And then what they would be looking for again is diastasis, which is a split in your rectus abdominis muscle. So that rectus abdominis muscle is the muscle that you see with the six-pack abs, which looks really nice, totally dysfunctional. So I never recommend my patients to strive for that, but that's a whole nother topic. And then pelvic floor dysfunction. So first we're going to talk a little bit about what your core, and then we'll get into what is your core, and then we'll get into what does pelvic floor dysfunction really mean, what are some symptoms that you may have if you're having pelvic floor dysfunction or issues with your core. So your core is like a canister. On top you have your diaphragm, and on the bottom you have your pelvic floor muscles, as you can see in this picture. Then you have not just transverse abdominis, but transverse abdominis, internal and external obliques, rectus abdominis. In your back you have multifidus. So this is just a nice little picture to show you kind of what I mean when I say core, because a lot of times people only think of rectus or just your abs. So again, those are all the muscles there. And we're going to talk a little bit about why your diaphragm is important as well as we go through this. Your diaphragm is the muscle that you should be using to breathe. And again, due to postural changes and different things over time, a lot of times our diaphragm isn't used to its full ability because we're more or less squishing it, for lack of, I guess, technical term. But when you sit slouched over, then it doesn't allow your diaphragm full expansion. So when we talk about posture later on, we'll get a little bit more into that. So believe it or not, there's different problems that occur in your core and in your pelvic floor, one and the same, during pregnancy. And this occurs in 1 in 3 women, which when you think about it is pretty huge, especially for an area that's being so underaddressed. So like I said, all of your movements start from here. Your core is your powerhouse. So if you're having any of these issues, then if there's an issue in one area, your core is not functioning properly as a whole. It can't. So if your core isn't strong and you're returning to exercise postpartum, for example, then I would almost guarantee that usually you're using compensatory movement. So you're compensating through a movement instead of doing a movement properly. So if there's a split in rectus abdominis, that obviously causes weakness. And usually during pregnancy, if this starts to occur, women can actually feel like a little bit of a weakness in your strength. That it's kind of one of those things where you didn't realize how much you used your core until now there's a split down the middle of it, and it's hard to push something, or it's hard to twist something and turn it open, or even sometimes pushing a door open, things like that. You don't really realize how much you use that. So during pregnancy, obviously, then we can see decreases in diaphragm function, because as baby gets bigger, your diaphragm is kind of pushed upward a little bit. Plus, if you're not using good posture, then that's really making that problem even worse. due to pelvic floor either weakness or spasm, you can get urinary and or bowel incontinence, meaning, and that can be anywhere from just small leaks to large amount of loss of control. So that can start during pregnancy with pressure from baby, but still can be prevented through strengthening that pelvic floor. And then it's definitely something that after giving birth through labor and birthing baby, that those muscles all get stretched to a new level. And then if they are not properly rehabbed, there can be long-term issues there. And this is kind of where we hear older women say, oh, well, I've had a couple of kids and I'm in my 50s or sometimes even younger or older. So this is just part of being a woman, and it's really not. It's just, I would say, the fault of the lack of education in the system and lack of it being just under-addressed. So when we talk about pelvic floor disorder, that also includes pain, just pain throughout the day, pain during intercourse, pain during certain activity, and then, like I said, to hyper or hypotonicity. So hypertonicity is if there's a spasm in the pelvic floor, and then hypotonicity would be if there's weakness, not enough strength in the pelvic floor. All right, so let's go on to this. So this is kind of what I just talked about. You hear this, don't own this. This doesn't have to be part of being a woman dealing with those issues. I mean, realistically, it can get to the point where it's affecting people's life day to day. Sometimes women start to not go out as much, or they won't travel as much, or they won't do the things that they like to do, like running or biking or horse riding, different things, because this is such a major issue for them. Whoop. So to start out, I'm just going to tell you a little bit here. One second, I just want to make sure we're still going and that everybody can hear me. All right, I'm going to start back on this slide here. Okay, so where to start, whether you're at any stage of the game, like I said, preconception, whether you're prenatal, postpartum, or whether you had kids years ago and you really just want to know, you don't want to deal with this anymore and you want to know where you should go. BIRTHFIT.com is a great resource because we post things quite often, and they do things every Friday on Q&A, but they also have exercise videos linked from their YouTube page, which is what the BIRTHFIT headquarters YouTube page is. Then the Dr. Erica's functional progression. So this is something that I put together based off of movements that I learned with the DNS therapy, like I was mentioning earlier. Those videos are broken down into 4 stages. And usually postpartum, I start moms with the sideline oblique kick through is what it's called. So as you go through that's one of the, it addresses the core. It helps approximate or bring together the diastasis. And then also at the same time is activating your pelvic floor when you do the kick through. So if I have someone with weakness in their pelvic floor or major diastasis or even slight diastasis, I really start them here. And I also give this to expecting moms and moms that are planning on becoming pregnant, because it's something that realistically you should do all the time in order to just keep your core healthy. When I say all the time, I mean, if your core is in generally good condition, you could do it maybe, a couple times a week. And if you're during pregnancy or postpartum, then maybe we'd alter that a little bit to doing it more frequently. But like we said, you are definitely setting yourself up for better movement patterns by strengthening there. So if I have someone with a spasm in their pelvic floor, I would still have them do this exercise, just maybe not add the kick through until we figure out how to teach them how to relax their pelvic floor. So a lot of times as a chiropractor, if I suspect that someone has a spasm in their pelvic floor, I will be referring to a physical therapist that does internal pelvic floor work. And I'm thankful to have a good referral system set up with that here. So that's really important to figure out too, because one of the biggest signs I see in a spasmodic pelvic floor, a pelvic floor that's overactive, is usually pain during intercourse. Again, that can happen with weakness in your pelvic floor too, but it's something that you want to talk to your provider about. And if you're having any of these issues, don't be afraid to ask, and don't be afraid to talk to them, whoever it is, whether it's your midwife, because then maybe they can help you find someone that can really address this. And if it's your chiropractor or your physical therapist, then they definitely should know what's going on with this. And if not, it's really their duty to point you in the right direction to help you get through this. So doing those functional progressions, and then you're also going to want to continue to work on upper and lower strength throughout pregnancy. You're training for the biggest and most important athletic event of your life. So keeping strong and active throughout your whole body is extremely important. And as far as cardio goes, I always tell people, any type of fitness, really, you just have to find what you love. Especially during pregnancy, if some people feel fantastic the entire time, but some people don't, and some people get tired and some people get sick. So doing something that you love to do is going to be key in keeping you motivated and keeping you realistically training for birth. So I would encourage you first to check out BIRTHFIT.com and then the BIRTHFIT headquarters YouTube page, because they have a ton of good videos on there as well. So during the prenatal period, again, remain active, be smart, listen to your body. This is a time when you don't necessarily need to push yourself to the max. If you are active beforehand, then, some days you'll have those times at the gym where you feel like you can't possibly do anymore, but you realize it's because you lost a little bit of sleep, so you're just going to push yourself through it. Whereas with pregnancy, you really need to just be in tune with your body and listen to your body. And some days you're going to have a day that you feel like, oh my gosh, I've never felt so good. And other days you're going to feel like not even going into the gym. Usually women say that if they at least get out and go do something, even if it's light, that they'll feel better even with their morning sickness. So just remembering that as you become pregnant and start into activity during pregnancy instead of preconception. A book that I think everybody should read, whether you have or whether you are pregnant or already have children and plan on having more, or plan on having children someday, is called Exercise Through Your Pregnancy. This book is amazing, and it has a lot of easy to understand research on why remaining physically active is so important during pregnancy. And for some reason, it isn't mainstream media. I'm not sure why, probably because it's not exciting enough for them. But it's easy for people that don't even like to read research to understand the benefits that not only for you, but for your baby as well. So when we're talking about staying active in regards to core and pelvic floor during this prenatal period, like I said, there's videos and links on the BIRTHFIT page. And there's also, BIRTHFIT we just released our Queen in Training ebook, which is, I think it's like $19.99. It's extremely affordable for all of the information that you get in it. And it's not just cookie cutter, it's broken down by what type of birth you had. And then you get a training guide with links to videos and even links to music to listen to. So that's an awesome resource to have too. And then during the prenatal period, and always, we want to focus on our posture. So when we talked about your diaphragm, which is part of your core, it's extremely important for baby's positioning and for your breathing, which is going to help get increased blood flow to uterus and to baby, for you to have good posture. And when I say good posture, I mean not necessarily sitting up super straight, sticking out your chest, but pretending that there is a string from the very top of your head and someone is pulling your spine, like elongating your spine to the ceiling. So that's what I mean when I say proper posture, as far as just day to day, but also proper form and proper posture during your exercises. So if you're watching my videos on the YouTube page, the biggest thing about that is making sure that you listen to how to properly set up your own body. And then I often encourage women to watch themselves do the exercise in the mirror a couple of times at least, so you can make sure that your form is done right, because if not, then you're just going to be compensating in other areas. So obviously preparing during the prenatal period is going to help you during birth, but then it's also going to help you recover faster postpartum because your body is already in that much better shape. So this one here that we have is just say no to sit-ups. So I'll go on a little bit of a soapbox here, but whether my patients are male or female, pregnant, not pregnant, kids, no kids, I really realistically in general tell them to avoid sit-ups. I used to say that, you know, the only time that I'll be okay with you doing sit-ups is if for some reason you're doing a body show and then we're just gonna have to fix it later. However, if any of you saw the pictures that Dr. Lindsay Muma posts from her Miss Raleigh, Mrs. North Carolina pageant this past weekend, she's got some very nice abs, and I know that she doesn't do sit-ups either, so now I'm changing my tune because I don't think you need them at all. It's way too much activation of your rectus abdominis, which if you're doing sit-ups to treat a diastasis, you're actually making the problem worse. And it's also really hard on your low back. So just something that it's not a functional movement. You would never see a baby sit up from laying back as long as everything has developed normally. And when I say that, that brings up a good point of, if a baby is developing properly, watch them move and then strive to be like them, because usually they have really clean, really functional movements. And when you're doing exercises, think about that as well. You don't often see a baby bend over at their back to bend down and pick something up. They are in a deep squat, so not a squat at 90 degrees, but a deep squat, which can also help open up your pelvis towards or throughout pregnancy to help with labor. It's a great position to get into during labor. But sit-ups and then crunches realistically as well are just dysfunctional, and you're actually going to make your problem worse by doing them. So as much as people don't really like to hear that, it is what it is. So also a lot of people that I hear that are going to gyms and they're told to suck their belly to their spine to stabilize. What you really want to do with your core, as I said before, you saw that it's like a canister. So you want to brace outward a little bit, like if someone were going to punch you in the stomach, how you would brace for that punch. You wouldn't suck your stomach into your back. And actually, if you try this out, if you try to suck your belly to your spine, you can feel your low back tighten as well, and it's just really not as comfortable. And I tell my BIRTHFIT moms that the only 2 times you can suck in are during pictures and cocktail parties, but realistically, never. and that affects your posture. That affects your core when you're in bad posture as well. So bracing outward during any exercise is going to help build that stability of your core and again help with those proper movement patterns. So now we're going to get into the postpartum period. With a vaginal birth, I'll go over C-section as well. So for the first couple of weeks, and it talks about this in the Queen in Training ebook as well, the first couple of weeks should really be focused on spending time with your baby, bonding with your baby, establishing that connection. It's pretty cool that actually if you just set babies on mom's belly, most time they will start to crawl up mom's belly after a period of time and find their way to the breast themselves, which when you think about it, it stimulates so much. It stimulates the release of milk for mom and those good hormones for mom, and then it also helps contract the uterus. So uterus is healing faster, which also helps with healing of the core. And then it's also where baby starts to integrate into their own system and start their own movement patterns properly. So really focusing on spending time with baby, and hopefully you've worked on diaphragmatic breathing or breathing with your diaphragm, expanding your whole lung field, but not using your shoulders to breathe. Hopefully you've been working on that throughout pregnancy and at least, and if not, then before conception as well. And then this is a time to focus on that. Not only does it help to maintain or regain the proper function of your diaphragm, but it's a really good time for you to just take a couple of minutes for yourself. And that doesn't mean you can't bond with baby during this time either, because baby can lay on your chest while you do your breathing. And it's just really something to help start towards that core rehabilitation in that postpartum period. So 2 to 6 weeks postpartum, depending on how your vaginal delivery went, is when you really want to get back into movement, exercise-wise, which starting out slow, use your baby as a weight, use resistance bands, wear your baby, put baby in a functional carrier and go for little walks, wear your baby when you're walking around the house, and pay attention to how you feel in your core. And then again, as I mentioned earlier, never be afraid to ask for help with something like this or ask for suggestions. Dr. Matthews in California is now doing phone consults, and so don't ever hesitate to reach out to her and schedule a phone consult or one of the affiliates. And definitely, if we are not close enough to help you, then we will make sure it is part of our duty to find someone close to you that can give you some advice on this. Again, the Queen in Training BIRTHFIT ebook, I can't really say enough about that. It's definitely worth your $20 to get that. And just, I know for myself, sometimes it helps me to follow a schedule. So you have the training schedule and you can check off the days, and it's individualized to your birth experience as well. So it's pretty cool that way. And then as far as starting rehab on your core, 2 to 6 weeks postpartum. So a lot of this work is going to be sideline work, like a sideline plank. The sideline oblique kick through is one of the videos that I show, and then moving through the functional progression. So while I'm not showing you these right now, it's because you have access to those videos, but also there's one called the supine dead bug, and that's how we start out our functional progression. And this is just making sure that you can hold that brace in your core and helping, again, to strengthen all of the muscles of the core and the pelvic floor. Again, here you want to make sure you're using good posture as well. During pregnancy, we gain weight in our chest, we gain weight in our belly, often gaining weight other places, and your center of gravity is a little bit different, and your posture starts to change. A lot of times we see that increase in the curve in your low back, and then our shoulders tend to come in and be a little bit more slouched over. Well, this doesn't change a whole lot after baby is born if you're not conscious of it and working on it throughout, because now hopefully you're nursing baby and or holding baby, so you're still in that forward posture pretty frequently, and you need something to counteract that. So while nursing, make sure you have a really good support across your low back. Make sure you have support all the way up your back, a comfortable pillow. We just got some new pillows into our office that are going to be released in Babies R Us soon, and it comes with a lumbar support, and then the breastfeeding pillow itself is really wide and it folds under to hold baby up higher, so it's a lot more functional than like the Boppy and some of the nursing pillows that are out right now, and it'll help you to have that posture. And nursing is also a good time to work on your diaphragmatic breathing. So cesarean is obviously going to be a little bit different, still focusing on spending time with your baby right away, and then still actually diaphragmatic breathing begins right away postpartum. Not every C-section is planned, thankfully. Emergency C-sections, we wouldn't be able to have that foresight and wouldn't have necessarily talked directly about that beforehand, but still maybe you've been working on diaphragmatic breathing. So with a cesarean, it's a lot of times it's hard for mom because people think, you know, it's still, there's so much focus on baby, and this is a major abdominal surgery. All of your abdominal muscles plus your uterus are cut through, and then scar tissue forms. And when scar tissue forms, it forms thicker than the original tissue, and it can adhere to tissues around it. So this is why diaphragmatic breathing is huge to do after a cesarean, because it can help to mobilize that area and help to prevent scar tissue from being maybe as extreme as it would have. And then later on, once the scar is healed, then I always encourage to have some soft tissue work done to that cesarean scar. And even if you don't have major issues with it right away, that's awesome, but you need to keep that area mobile. So finding someone that has experience in that or someone to point you in that direction is key. And then what that should look like is them helping you mobilize that scar tissue, but then them teaching you how to do it on your own so you can continue to do it. Exercise itself, you're definitely going to want to wait until your 6-week checkup to make sure that your scar is healing properly, that there's no major issues going on. And then I would really recommend you to start core exercises under supervision, or like watching the videos, making sure you take time, go slowly, and really listen to your body. If it causes major pain around the scarring, then that's something to bring up to your practitioner. But we're really going to treat the rest of it the same as far as the exercises that you're doing. Cesarean can be hard to focus on posture with because, again, those abdominal muscles are not just stretched, but they have had surgery to them. So sometimes women just subconsciously are a little bit more guarded about sitting up straight for fear, even if they're not thinking about that fear. So starting the diaphragmatic breathing right away can be good mentally too, because it helps you. It's kind of reassuring a little bit, like, okay, I can do this. There's things I can do, even though they're maybe seem little right away, they're really going to be beneficial big time in the long run. Also, so when we talk about our core and pelvic floor, you don't want to forget about your posterior chain as well. So we're talking about all these postural changes that we go through. And when we have that increase in the lumbar curve in your low back, rounding of the shoulders, a lot of times we get short in the muscles in the front of your legs in core, like your hip flexor muscles, your quadricep muscles. So doing things to activate your posterior chain, so glutes, hamstrings, things like that are also going to be important. And this is during prenatal and postpartum as well, because it's going to help you during labor, and then it's going to help you after labor, just as all of the core exercises are going to do. So these are just a couple of exercises that you can look up and find more information on. Don't hesitate to contact me if you have any questions on any of this. I'd be more than happy to send you the videos that I have, or refer you to more videos if that's what you're looking for. But really remember to keep your body moving functionally as a whole. And so this is something to focus on once you make sure that your core is stabilized. And I really cannot stress how much I like the program that we've set up with the Queen in Training postpartum ebook, especially if there isn't a BIRTHFIT postpartum course near you. My last BIRTHFIT postpartum course I did, I had 2 moms that were 5 weeks postpartum, and then a couple of moms in between there, and then one mom that her youngest was 4 years. So she is a mom that runs a lot and is having some issues that are possibly what I think due to core instability, and it's years down the road, but like I said, it was never addressed. So now she's still dealing with it. She's still having those issues, but it's never too late to get help with that. This is just a picture of the Queen in Training ebook. Whoops. So I'm going to go back to this one and talk a little bit about so when you're looking at all of these exercises, a couple of big things to come away from are really avoid sit-ups, avoid crunches. Don't be afraid to speak up and ask for help. We are all a great resource. All of the affiliates are really passionate about helping you. And whether you're listening right now as a mom or a practitioner, make connections with people in your area, and we can help you do that as well with where to send people, because this is something that definitely affects moms for years down the road. And I just received a really nice letter today from one of the moms I worked with recently, thanking me for helping her, and she's been struggling with some issues. Her youngest is 9 months old, and she's still struggling with issues and didn't really have anybody to go to before. But just make sure that you find someone that you can connect with that way, and don't just settle and don't just own a dysfunction or deal with something just because society makes it seem like that's what we're supposed to do. If you have any questions at all, please type them in now or email me later. I'll give you my email address is ebolanddc@gmail.com. So I check my email every day, and it may take me a day to get back to you, but I'll definitely get back to you as soon as I can. And if I am not close enough to help you, like I said, I'll find someone in your area that is. So I'm just going to go over a couple of the main points again. Reasons to work on your pelvic floor and your core stability. It's awesome if you're ahead of the game and you can do it before you even conceive. It really just sets your body up on that stability plus that activity level and can help carry you throughout. And then during pregnancy, if you can stay active but really focus on your core, focus on pelvic floor during that time, then it's going to help you have less issues with maybe aches and pains during pregnancy, and then also recovery postpartum, and then obviously keeping with it postpartum or starting postpartum. It's never too late to start. The one thing that I wanted to talk to you about, or one other thing I wanted to talk to you about at the end here too, is Kegels. Usually sit-ups and Kegels are something that are told, or advice for moms, do your sit-ups, do your Kegels, and you should be fine. We already discussed that you shouldn't do your sit-ups. You can replace them with the functional progression videos and exercises. Kegels are hard, and it's not something that I necessarily tell patients not to do. How I instruct patients to do them is to sit, pretend like there's a straw inserted in the vagina and like you're trying to suck up through that straw, with the knowledge that you're not supposed to activate your glutes or your abdominal muscles. However, a lot of times women are confused with that because they think activating glutes means you won't feel any activation of your rectum, which is false. That's part of your pelvic floor. So you may feel a little bit of activation around rectum, but you shouldn't be squeezing your glutes together in order to activate those muscles. And the biggest thing for me with Kegels is literally there is no way for me to tell if you're doing them totally correct unless I refer you to someone that's going to do internal pelvic floor work, which I have no problem doing, and I have done, and women have really great results with it. But it's just the progression exercises and the different exercises that we show can also target pelvic floor at the same time as core, and I can monitor that you're doing it properly. So that's why I like them more than Kegels. But if Kegels are working for you, then I just really strongly recommend that you do them. As I had just said, and actually Dr. Muma has an awesome video on the BIRTHFIT.com site instructing you on how to do Kegels. So that's something that you may look into checking out as well. So I hope you all got some good information out of this webinar, and I look forward to doing more webinars with you in the future. Feel free to email me feedback, constructive criticism if you'd like. Definitely don't ever hesitate to ask any of us any questions, and good luck in your pelvic and floor proper functioning quest, and I look forward to hearing from you.